today.
Thank you, Chairman Patty. We do have about 4 or 5 public comments this afternoon, and then I do have 2 additional comments following this afternoon's discussion regarding the vaccine.
Very well, thank you.
So the first comment that I will read today is from Pam and Bill Rapp, which writes, "We are very concerned with the growing number of the homeless in our waterways, under the freeways, in parks, on sidewalks. It is a feeling that our city and county is waiting for funding for permanent housing, while we feel that the homeless need to be in any kind of housing, not necessarily a home. Perhaps the existing organizations like the Gospel Rescue Mission, etc., can be aided to expand capacity and services through partnership to help those in need. Taking food, etc., to the homeless is only enabling them. Providing tents so that they can live out in the elements is ridiculous. We have such wonderful and caring organizations that are in place but need a helping hand to do better what they do already. St. Mary's and the homeless shelters there are old and in need of better facilities, etc. We can't allow our city and county to become a trash pit. Can we pay some of the more capable homeless to help build or clean up? There used to be gangs of those working off fines that would be used to clean roadways, like the Street of Ryder near Alpine, Michigan and Country Club, where there are piles of trash along the fencing. Thank you for considering this emergency in our city. There is such an opportunity to make Stockton, with its beautiful waterway, a place to see and visit. How does Sacramento find ways to take care of homeless? Tents don't do it. Where are the promised trailers, small homes, etc.? The next comment is submitted anonymously and writes, I predicted that the board would not read any comments that oppose the rehiring of Chris Bellagio for the Public Works Director appointment, and that his contract would just appear under consent at the next board meeting. But you did surprise me by actually scheduling a special meeting to do it. Even though the chairman and the county council circumvented the reading of my public comment on January 5th by pulling the discussion item after hearing it in closed session, it appears the supervisors and county council read it, since the board letter for this item suggests you have done the right thing by rejecting Chris Bellagio's attempt to spike his pension and defraud the county's retirement system. However, the board's actions of rehiring him is a clear indication that his defrauding of the state taxpayers and the CalPERS retirement system, in addition to his conduct of dishonesty, discrimination, favoritism, and other unethical behaviors as the Public Works Director, is condoned and encouraged. There have already been 3 lawsuits filed against the county due to his behavior and poor leadership, 2 for 6-figure amounts and 1 pending for 7 figures. And there will most likely be more. In addition, there are many people and officials aware of his poor stewardship of the taxpayers' money. So you should expect additional inquiries and investigations as a result of his rehire. It is your job to protect the taxpayers of this county, and with this decision, you are failing miserably. The next comment is also submitted anonymously and writes, Bellagio quit in July 2020, and it was the best thing to happen for the employees, taxpayers, and department. While he was a director, taxpayer money was spent frivolously on awards that did not benefit the public. Consultant contracts were given to his friends and previous associates without competitive bidding. His previous employer, AECOM, prepared a grant application at no charge and then was awarded the contract to design the project after the grant was approved. Work was performed at no cost for property owners who were connected in some way to Bellagio or the Board of Supervisors, but not for all. Large sums of money were spent on the supervisors' pet projects that did not benefit a large number of constituents. Employee morale was extremely low due to the environment Bellagio promoted of favoritism, retaliation, harassment, and discrimination, and many longtime talented and loyal staff members were driven out. 2 lawsuits have been settled for $700,000, and 1 is pending for $1 million against the county and Bellagio personally due to his behavior and the environment he created. The board and the CAO are aware of all these things and are still going forward with rehiring him. While you may be getting a yes man, you will do things for you that go against the rules and regulations Public Works is supposed to follow. You are also placing the county at risk of additional lawsuits and losing more good employees and managers who cannot tolerate bullying and unethical behavior from their leaders. The next comment is also submitted anonymously and writes, "The key question is, why is Mr. Balaji returning after only 6 months? Has anyone on the board asked him that question? If so, what was the answer? The public deserves to know. The obvious answer is he's working the state and county retirement systems to maximize his benefit and compensation. Hopefully this will be investigated fully as it fails to pass the smell test. The board is failing and constituents of this county by rehiring him. As I can attest from firsthand experience in working with him, that serving the public is not his primary or even secondary interest. That he is requesting this precedent-setting compensation should be a red flag the size of Texas. Does San Joaquin County want to be the next city of Bell, California? Mr. Balaji, while seemingly impressive to those he answers to, namely the board members, is a very toxic leader to those who work under him and a minimally tolerable person to those at his level. He has two sides, a pleasant one and a very unpleasant one. During my time working at Public Works while he was the director, I sadly watched several good employees retire or leave the department, and they consistently cited Mr. Balaji as the primary reason. I further witnessed him berate several staff on various occasions for very minor things like a typo or for essentially not being able to effectively read his mind. The county can do much better than Mr. Balaji. And the final comment that I have was also submitted anonymously, and they wrote, "Consideration of hiring Chris Balaji to the Public Works Director is a travesty to the community and employees of the department. Chris had harassment claims against him while working for other employers in his career. Other examples include harassment and discrimination cases when he was previously a San Joaquin County employee, unethical practices with his professional license, and more recently requested the county to rehire him using pension spiking techniques, previously board letters, and his own boasting that are exactly why pension reform regulations are in place. This shows selfishness and entitlement. If they hire him with this information, then you are risking taxpayer dollars on the line with knowledge of his poor and dangerous decision-making skills. Chris will urge that these allegations are false, but his best interest is his pocketbook and not the county. As I fear he will be appointed anyway, I wanted to make sure this letter of no confidence is on record, anonymously." And that concludes the comments that we have for public comment.
Thank you, Madam Clerk. If we have anybody here in public that would like to make a comment, so we'll close that portion of this meeting. We'll move forward to consent. Under general government, we do have a brief presentation, I believe, from Mr. Powlin as it relates to the appointment of the director for the Public Works in San Joaquin County, effective, it says, no later than February 1st of 2021. Mr. Powlin.
Thank you, Mr. Chair. Under Government Code 54953C3, that requires an oral report on salary or compensation before the board takes action. Today's action recommends the Director of Public Works appointing salary to be $196,119,000 annually.
Thank you very much. I'd like to ask if there's any board members have any questions or any comments regarding this item. Yes, Vice Chair Nguyen.
To the CO, is the compensation any higher than it would be for any other employee taking that position?
No, his compensation is the same as other equal department heads.
Okay, thank you.
Okay, thank you. Seeing no further questions, I do have a couple questions. And actually, we had done a comparison of other counties, comparable counties. We have a 10-county comparison, and our compensation package for this position and or others is not at the highest peak throughout that comparison chart. Is that correct?
That's correct.
Okay, thank you. I do have a question. It does say starting effective no later than February 1st of 2021. Is Mr. Balaji available prior to that?
My understanding is pending board approval that he will be available to start earlier than that February date.
Okay, great. Well, thank you very much for that. Seeing no further questions, then I will entertain a motion and a second and vote to approve consent item number 1.
I'll make a motion to approve consent item number 1.
I'll second.
I have a motion and a second. Madam Clerk, would you please take roll call? Or we can vote. I'm sorry.
Yeah,
We can
you
vote.
can
Okay,
vote
thank you.
electronically.
We can vote on the computer. All right, we are complete. That has adopted, and we have a vote of 4-1. So that concludes item number 1. Let's see. Going on then to our next part of our agenda will be a COVID discussion. Board of Supervisors has asked some of our department heads to come on in and discuss the COVID-19 vaccination plan. Do we have staff present? And come on down and give a report, please. For the record, we have Healthcare Services Director Greg Dietrich and Dr. Maggie Park, Public Healthcare Officer.
I do have a presentation, and I'll try to get through it quickly to keep it brief. So mass vaccination update as of today. So mass vaccination campaign for an infectious disease pandemic is a complex enterprise that requires balancing different strategies for allocation, distribution, administration, access monitoring, and other considerations. Each infectious disease outbreak differs in terms of its clinical characteristics, epidemiology, impact across various populations, and each outbreak requires a tailored mass vaccination approach, that coming from the NIH. So our framework is that we are to follow the best practices as recommended by the CDC, the ACIP, CDPH for allocation, prioritization, and distribution of the vaccines. We use a public health framework for safety, efficiency, transparency, equity, as we look at allocation, distribution, and administration. We leverage and expand the use of existing systems, structures, and partnership across all levels of government. And then as far as numbers go, as of the 15th, and this is constantly changing, but we had received total doses of Pfizer and Moderna. As you see there, the numbers that were received to date, and the total number of Pfizer and Moderna vaccines that have been delivered. By delivered, we mean allocated and repositioned to vaccinators. So what we've given to the hospitals, what we've given to our FQHC clinics, and a couple of other partners who are vaccinating in the county. And then the total doses administered, being close to 17,000, reflects the number of actual injections given. Some of those include second doses for some of the doctors and nurses who were first to go in our hospitals and were already getting their second doses in the last week or 2 weeks ago. This is just a breakdown by gender. And then this is something that we're going to be putting up on our website to show a general time frame. I know that the public and various people have been very eager to see when might they be vaccinated. And so we are trying to come up here with some generalized dates as to when we think we will be moving from tier to tier. It's very difficult to be precise on this and to make any commitments because the influx of vaccine per week from the state is so questionable, and we have no idea until the week before how many we're getting from the state. And it has become somewhat of a trickle lately. We're not getting large amounts of vaccine, yet we're being asked to vaccinate more and more groups as the state has made more announcements and added people. In particular, last week the governor made an announcement about vaccinating people age 65 and over. And there are a lot of 65-year-olds who are listening to that and wondering where they're going to get their vaccine. But the actual amount of vaccine we have on hand is quite limited, so it's been a challenge. Phase 1A is the healthcare workers, and I do want to say that this was quite a challenge to find every single one of them. You know, the list here shows 4 groups, but most people think of healthcare as the hospital. It really expands well beyond the nurses and the doctors in the hospital. We had many, many groups we had to reach out to, including substance use disorders, treatment center staff, Valley Mountain Regional Center staff, dialysis clinics, Planned Parenthood, promotoras and healthcare workers who are working out in the field for community-based organizations. So not just your pharmacists and your dentists and the ones you might think are obvious, but there were many, many groups. Come this week, I can pretty much say that we have reached out to every group and offered a chance at vaccination. Some are still waiting for their appointments to come, but they've been given a process for which they can obtain vaccine. So through this process, I will tell you what some of our strengths have been, and that is that we've made multiple partnerships with various organizations, and we've coordinated with the Medical Society as well as the Dental Society. We've developed a survey, first of all, with the Medical Society to find all those doctors out there who are not affiliated with the hospital and could not then be vaccinated through the hospital systems. So your cardiologists, your urgent cares, your hematologists, people who needed to get vaccine for their nurses and their medical assistants and their staff. We developed a form, interest form, collected numbers from them, and then we sent them flyers with information as to where they could be vaccinated, and they've been signing themselves up and making appointments. We've onboarded over 35 partners in CalVax. This is a system utilized by the state for people who want to be vaccinators. So we have assisted with that process with various entities who have wanted to be vaccinators. It's quite a rigorous process, and it is a rate-limiting factor. But we have assisted some doctors' clinics and some other entities like dialysis centers who have wanted to vaccinate themselves and want to be prepared to vaccinate their clients. We have onboarded other people who are either vaccinating or will be soon. That includes Safeway Pharmacies, CMC, our San Joaquin County clinics, HR Support, WellBe Health, which runs the PACE program, Save Mart Pharmacies, and UOP, and we're also talking with Delta College. There has been daily outreach and recruitment updates. We have discussed plans also with the Office of Ed as to how we can move forward with vaccinating teachers and all the staff at schools. And there is a plan where the district nurses are applying also through CalVax, and once they have that authorization, the plan is that they will move forward with vaccinating their staff. So very large undertaking, and we're happy that the Office of Ed was willing and able to do that. Another strength is that we've had clinical TA support with weekly office hours that we provide to providers who are on the COVID Ready system, which was the former name for CalVax, who have been approved. We've been offering weekly meetings to give them technical assistance on how we'd like them to order vaccine from us, how they need to manage the cold chain so that there's no loss of vaccine. I've scheduled weekly orientation trainings for providers who are interested in registering, making sure that they understand how to use Healthy Futures and the vaccine registry system called RIDE. There's been constant monitoring of a unique email address that was created for people who need technical assistance. IT support included setting up of an electronic ordering system for providers who are receiving vaccine, help desk with assistance with Healthy Futures. As I said, again, that is our vaccine registry system. Our IT team developed clinic workflow and Healthy Futures to assist with this on-site data collection and worked with CDPH and CDC to connect to an immunization gateway to ensure registry data is reported within 24 hours of vaccine receipt. The cold chain management and distribution, another strength of ours was that we had this ultra-low temperature freezer early on, so we were able to onboard early. We were able to pre-position Pfizer vaccines and pre-position Moderna vaccines, so we were considered a pre-positioned site, first in the region to be able to offer these vaccines to our hospitals. We delivered vaccine within hours of EUA approval. As soon as the FDA gave approval, we were on the receiving end of vaccines, and within hours of receiving them, we then distributed to our 7 area hospitals that very first week in mid-December when all of this started. We developed a distribution system quickly, hired staff to support it, set up biweekly deliveries of vaccine, and so all of our hospitals and all of our vaccinators understand our process. We've asked them to put in orders a week ahead of time for vaccines deliveries that happen twice a week. We have a courier service that takes it out to them. And we've collaborated with other agencies within the county on a mass vaccination clinic. Our risk communication developed draft mass vaccination communications plan and a referral flyer for the healthcare workers. Those, again, as I said, who we were referring to Safeway Pharmacy or to San Joaquin County clinics or elsewhere, those who were not affiliated with hospitals, also doctors, pharmacists, dentists, anybody who still needed a vaccine and was in phase 1A, there was a flyer directing them as to where they could go and how they could make an appointment. Some of this process hasn't been visible to the public, and I understand that the public wants to know what we're doing, and so I'm grateful to have this opportunity to show it. But the reality was we couldn't show this flyer on our website and make it public because it was only reserved by invitation only for our healthcare workers, and we didn't want to inundate these clinics with people who are not in phase 1A. Community engagement, we've discussed mass vaccination communication strategies with Health Plan of San Joaquin. They also helped to disseminate that information to our medical doctors. Dignity Health, First Five, other community partners within the Resilient Community Advisory Committee. So we have many partners assisting with us with this effort. Collaborated to address concerns with the African American populations, with the NAACP, Mary Magdalene, REACH, Amelia Adams, and other community leaders. And we've partnered with healthcare leaders in addressing vaccine safety and vaccine acceptance. And some of the challenges have been, as I said, what was early on a rate limiting factor was the approval process, as we had some people who wanted to be vaccinators waiting in the queue, and we had vaccine up front that we could have given to them earlier, and it's taken a while for the states to get the approvals in. Then they shifted from the COVID Ready system to the CalVac system, and there was a period of time during which no applications could be processed as they switched to a new online system. There's been some lack of an effective coordination between the state and the local health department level. When in regards to expanding the phases and tiers, there's been, mixed messages, and of course, some additions made to the phases and tiers. Just as we think we're finishing up 1A, then we learned that funeral homes and mortuaries have been placed in 1A, and we need to take care of them as well as healthcare workers. So this has been somewhat of a challenge, and hopefully, as we go forward, the relationship with the state becomes clearer. Storage, distribution, and administration, especially with the Pfizer vaccine, there's a very complicated cold chain, as I've tried to discuss in the past. It does come frozen, and it requires an ultra-cold freezer, most of which other entities don't have. Providers have been unwilling to administer for others. We've had many providers who don't want to be part of the vaccination system. There are many that are wanting to help out and vaccinate their own patients, but many that are relying on others and the system to vaccinate patients. Providers unable to meet the cold chain requirements to receive Pfizer, as I said, and then mandatory reporting requirements also kind of slows down the process because there are some entities that might be able to vaccinate, but then you also need clerical staff to put all of the vaccines into the registry. It's time consuming and it requires more personnel. The immunization registry, there's a data delay due to connectivity issues between Healthy Futures RIDE and the larger provider electronic health record systems. And so sometimes when we look at the numbers, although they go up constantly, we still feel that it's an undercount, as some of our larger multi-county entities, such as Kaiser, might be putting in vaccines, and it goes to a regional system, and it's kind of difficult to access and get the accurate numbers. And there's also delay when people are not putting this in within 24 hours. So next steps, we're looking constantly at improving communication and oversight mechanisms between ourselves, our COVID vaccine team, our CBOs, and our community leaders. We are updating and disseminating information to target populations about the status and the availability of immunization sites. We're updating our plans and training our providers and looking at providing culturally appropriate educational campaigns for our minority and underserved populations, expanding the number of vaccine sites based on equity measures and the Bayesian scientific risk score mapping. We're involving community leaders as we talk through our Resilient Advisory Committee on messaging and how to address vaccine hesitancy, trying to build public trust in the ability of the vaccination to control the pandemic. And we are encouraging healthcare facilities to also work with us on the messaging and integrating vaccinations with their other essential health services, which would really help out in the long run to get to everybody. I wanted to show you very quickly what I was talking about when I said that we are going to be looking from a health equity lens. As you know, the state has asked that we now do 65-year-olds and up, and there's about 100,000 of those people in our county. And most of them are being told that they should be looking at their primary care provider. That is the message, is you need to go to your Sutters, your Kaisers, your health care provider who should have that vaccine for you, and that's how you get vaccinated. But we know that in reality, there are people out there who don't have a provider who can offer the vaccine. Maybe they go to a small PCP, primary care provider, someone who doesn't have the ability to do it. So what we've asked Bayesian to do was to find where these 65-year-olds are, and so all the colored bars to the right are 65 and up, and all the bars in the faded color are those that are younger. And then out of those who are 65 and up, if you looked to the left, the top 25 census tracts with people with the most 65-year-olds and up are in that bar, are in that line there. And we can break it down by ethnicity, we can break it down by gender, and I will say that what Bayesian did was create maps for us, which we call heat maps. So if you look at the left side of this target cohort, age 65 and over, we are looking at, I'm sorry, that's the right side, we're looking at the population density. So you're looking at green being not so many 65-year-olds, yellow, more 65-year-olds, red is where there's a lot of 65-year-olds, and he's done this for us for the entire county for the top 25 census tracts. Then when you look at the COVID-19 Cora Risk Assessment heat map, same area, but with the colors indicating where people have the most COVID risk based on the Cora score that was developed by Bayesian. So people who are in that extreme category are in the red areas. And so just a couple more slides, just taking one census tract. This is a census tract at the very top of that bar on the side, which has the most 65-year-olds. And then if you go to the map of that census tract, you will see in clusters of yellow and red where we might want to focus our vaccine clinics, where we might want to send our mobile vaccination vans to. And it gives us a picture of a good idea of how we can try to reach people, especially those who might not have the transportation or the wherewithal to get vaccines. So it's interesting. You see McNair High School, you see Cesar Chavez High School nearby some of these communities. So this map was just developed for us literally over the weekend because the governor made this announcement just last week, and we received it from Bayesian yesterday, and we're going to be looking at this and looking at each census tract and seeing, is there a community senior center in one of these areas where we could set up a vaccine clinic? Do we want to engage at a high school? We know that HR support's already doing testing at Chavez High School. Do we then have them expand to do vaccinating there at Chavez High School? And it seems to be a good fit. So that's how we're going to be looking at this and moving forward. And I didn't want to show you all 25 census tracts, but I have that for any of you supervisors who would like to see it. Thank you.
Thank you, Dr. Park. Mr. Dietrich, did you have anything to add, or can we bring it to the board for questions?
I'd bring it to the board for questions. I do anticipate some changing guidance from the state being issued on Thursday. However, that's going to impact a lot of our planning.
Excellent. I'm sure that there'll be a lot of questions. I appreciate this information already shared. I did want to call this special meeting because I'm certain that all of us are being inundated with requests and emails about this, and it's a very moving target and very fluid. So I appreciate that we can share some information today. Questioning Supervisor Villapudua.
Yes, thank you, Chair Patty. Just curious, do we have a plan set up for farmers and farm labor, Hispanic farm labor?
Thank you so much for that question. We are talking. There's been much demand. I have had a couple of communications with our Ag Commissioner, but I need to be speaking with Mr. Pelican more. And then separate from that, I hear from the cherry industry and the almond industry. We don't have any specific vaccine clinic days set up for them. Moving forward, the state has mandated that we look at our 65-year-olds first and that we try to take care of them. So that's the focus as of last week, and I'm going to try to gauge how this goes over the next couple of weeks through the end of January. Do our Kaisers and our Sutters really have vaccine for their 65-year-olds? well, Adventist is vaccinating their 65-year-olds. How much of the rest of the 65-year-olds and up do we need to take care of? And then how much vaccine do we have remaining to then target some groups? And if we do have future mass vaccination clinics, we might open it up to people in general who are in the phases and tiers that qualify instead of doing it for specific target groups. I'm still working through that.
And Supervisor Leopold, I'd like to also add that I think we're close to now having a drastically more vaccinating capacity than we're going to have vaccine coming into our county. And between San Joaquin County clinics, CMC, public health, mobile clinics, as well as HR support, we are going to be doing outreach into these areas. But I think the governor really threw us for a loop last week when he came out and said 65 and over throughout the entire state. Initially, that was 75 and older, and it was changed a couple days prior to that at the federal government level. We were working still on moving through Phase 1A, which is the expanded healthcare community. We wanted to move into Phase 1B, which included 65 and up, ag, teachers, additional first responders, including law enforcement, and that announcement really threw us off track.
Okay. Well, thank you for that update.
Thank you, Chair. I have a
Supervisor Rickman.
question, so I can wait. And
I'm sorry?
I have quite a few questions, so if any other board member wants to go before.
You got the floor.
All right. Well, thank you, Chair. I just don't want to monopolize all the time.
I think I would just request that you maybe bring the microphone closer so we can hear you, especially while you have a mask on.
All right. Thank you. Thank you, Chair. Thank you, Dr. Park and Ms. Diedrich, for being here once again. And I'm going to run through a narrative, and I do have a number of questions that need to be addressed. You know, this past weekend, myself and a single member, Villa Pudua, showed up at the Ag Center. And I just want to say it was a fantastic effort, and it was very well run, point of distribution vaccination effort. And this success, to let everybody know, the effort was due to the efforts of our OES, EOC, EMS, and San Joaquin clinics and others that volunteered their time. So I saw the Sheriff's Department out there, Stockton PD out there, the District Attorney was out there helping out. So thank you all for your time coming out there and helping out the residents of San Joaquin County. And I'm hoping somebody can give a kind of a rundown of what transpired this week and how many vaccinations that we administered. But you mentioned on January 13th, you know, the governor, according to CSAC, or California State Association of Counties, and of course the news, the governor surprised many with a decree that all Californians aged 65 years or older have access to COVID-19 vaccines. And just reiterate, his announcements were made without local input, correct?
We did have a meeting with our partners from the CDPH, which are the medical doctor side and the medical side of CDPH. I don't ever have direct conference calls with the governor himself.
Anybody in San Joaquin County?
We were on a series of conference calls. We provided the input that this was going to cause frustration, as well as we had already made some outreach to teachers and other priority tiers. We provided input to them, but at the end of the day, the governor moved forward. You know, I think it was almost unanimous consensus from the counties not to do it.
Yeah, so we have approximately, when I say we have, I'm saying the state of California, approximately 2.8 million single doses available statewide, and we have more than 6 million people that are 65 years or older. So when you were talking about the shortage of vaccine, and my point is this, so how are we going to address, and you mentioned it briefly, the jump from phase or tier 1, 1A to 1B? So how are we going to do that jump?
This is the frustration with the announcement, is that it came at a time when we knew we were getting very little vaccine. So a lot of the counties are frustrated with the fact that we've been charged with vaccinating 65-year-olds and up. And as I said, we have 100,000 of them in our county. At the same time, I'm getting less than 3,000 vaccines this week. So it's a challenge. I'm not saying it's wrong. I do believe we need to vaccinate the seniors and the more elderly people who are more at risk of a severe outcome with this disease. But there's been very little guidance from the state level as to how to do it and how to prioritize within that group, how to find that group. We've been told that their first line of treatment should be to go to their primary care provider for the vaccine. And the state has indicated that multi-county entities such as your Sutters and your Kaisers will have direct shipments from the state and be able to vaccinate their own members. So it's the rest of the population that we now need to get to. And we plan on shifting to that population this week because we are, as I said, finishing up 1A. At least we've reached out to everybody as best as I think we could do in 1A and given them the opportunity. So now the shift is, and how do we attack this is a great question, is how do we make this equitable when there's such limited vaccine? And this is why I'm looking at the heat maps and trying to go into communities where there might be more risk and there might be people who have less access to health care.
And to add to that, Supervisor Rickman, the challenge is 100,000 people with the amount of vaccine doses we're getting, it could be literally months before we could get through all of them. How do we do some sort of sub-prioritization? Is it everybody that's 65, or should we target, let's say, the African American that's 75, that is poor and has diabetes and lives in one of our healthy places into census tracts? Because eventually we're going to be coming out of the regional stay-at-home order and back into the blueprint metrics. We'll be assigned in the purple tier. In order to move down to red, we have the adjusted case rate and as well the positivity rate, but there's a third one having to do with the positivity rate within those healthy places index census tracts. I think we really need to prioritize over 65.
All right. How far are we in the process of phase 1A till we complete it?
So there were just a couple of groups I needed to complete, and this past weekend's event was to get to 6,000 IHSS workers, the in-home service support workers who are in the Tier 2. And then the very last group that I needed assistance with was the funeral homes, and Dignity agreed to take over that. So we've got St. Joseph's vaccinating people who work in our mortuaries and morgues, community medical centers vaccinating our dialysis centers. They set up their own days. They're vaccinating the healthcare workers at St. Mary's Dining. Lodi Memorial is vaccinating doctors around their area. St. Joseph's vaccinating doctors around their area. Everyone's kind of wrapping up. I do believe that we have given out the phone numbers to the clinics that were available, to our dentists and our pharmacists and everybody else, and we need to now see have they all taken the opportunity, those who want it. And so this week what we're doing is the staff is reaching out to those clinics to find out how backed up are they with their appointments. Are we 1 week out or 2 weeks out? Are people still waiting 2 hours on the phone for an appointment? And are they prepared to move on to the next phase and to do more?
All right, thank you. So we should be able to jump to, when do you think we'll be able to hit 1B? Because for me, I think, those that are 65 years and older, a vulnerable population, need to be, immediately vaccinated, if they can. And looking at the numbers of what you cited today, we received approximately 34,025 vaccinations. We have administered 16,909, so that's a leftover of 17,116.
Yes,
so we have 17,116. You're shaking your head no.
That's an
Finish
undercount.
my question yet. So,
okay.
So we have 17,116 vaccinations sitting there.
So let me start with the question about 1B, which is separate from the 65. When you say...
Okay, well, then I'll rearrange it. Are 65 elderly or senior
we have started.
vulnerable?
We have technically started on them with the event at the Ag Center, and the day before that there were some pharmacies that started in on some 65-year-olds, some of our Safeway pharmacies. So we have entered that phase, and so it's kind of confusing because originally 1B was 75-year-olds in 1B Tier 1, and when the governor made his announcement that we would do 65-year-olds, he didn't clearly say whether he was tacking them on to 1A, whether he was just switching the 1B to from 75 to 65. But really what it was that we had to finish up 1A while starting on 65-year-olds. So we've started 65-year-olds, technically speaking, but we do need to ramp that up this week. And then when you say 1B, when we're going to start 1B, I'm thinking that you're asking about the farmers and the teachers and the law enforcement that are in 1B Tier 1, not the 65-year-olds. Those, as I showed on our projected timeline, would maybe be the beginning of February. That is the hope, is that we can finish off 1A as we start 65-year-olds through the end of January, and then phase into 1B in the beginning of February.
So what are we doing between today's date, January 19th, to the February 1st? I mean, each day, I mean, I know I got news of a few days ago, a friend of mine, and who passed away. You know, he would have fit in this category, 65 and older, and actually was 75 or older. And, you know, I can't help thinking, what if he would have got this vaccine sooner? So if we have vaccines, can we deliver to that population?
Right. So as far as the...
Put it another way, do we have, let's just get this question out of the way, do we have 17,116 vaccinations available?
We do. And the state has asked us that whatever we receive, we now keep 50%, which is very difficult. We now keep 50% because there's no guarantee, as they had before, a guarantee from the federal government that the vaccines would continue to flow in, and not to worry about second doses because they would continue to come. Now the state is asking us that to keep 50% at least of second doses because we don't know if they're really going to be available. The other issue is that some of the Moderna vaccine that would have gone out today and that would have been utilized is part of that lot number that is now placed on hold. So we have several thousand of those that we cannot release. And so we do have vaccine. We are able to keep going this week. And so the plan is to look and see what our partners are at. We're going to ask them, are you almost through with the 1A phone calls? Do you have ability to start getting our 65-year-olds in this week? Because if you do, we're going to be releasing your numbers to them.
Because I can't reiterate, and I can imagine every board member here, our phone's been blown up, and I just received an email here right before I came out here about a resident in Manteca asking about getting some of the vaccine for the assisted living homes. And, you know, one of the most frustrating things, at least for me, is, you know, asking me questions, and when can we expect it? You know, when is it going to come out? Where can we go? And I don't have any answers.
Yeah, I understand, and the frustration, you know, is felt on our side too, as people are sending this question to us as well. And so we will work to try to start ramping that up. But as I said, there's no guarantee that we'll have the second doses for them. So some of this is an ethical issue as to whether we really hold on to it or do we keep moving. And at this point, the CDC and Dr. Fauci and people from that level are saying you must continue to move on with a plan to do that second dose in a timely manner. We haven't changed things here in our country, so we're being asked to hold.
And we canceled clinics yesterday and today because that Moderna lot issue. The numbers you're stating, Supervisor, the 17,000 doses, that's an undercount because that is only what is reported in an immunization registry. Some of our partners are not entering that information in a timely fashion. And again, I think you're asked about this long-term care facilities. That is going to be one of our targets because I think the other priority we have is the most vulnerable among us, giving the vaccine to those that might require a hospital bed, an ICU bed, a ventilator, or unfortunately die from receiving COVID-19. So our challenge is how do we sub-prioritize those over 65 to get the vaccine?
And I will say that our long-term care facilities, we do have a plan for them. Our skilled nursing facilities have all signed up with the federal program, and they're being vaccinated through the CVS and Walgreens federal partnership. But the assisted living facilities, we know we're going to get into, and we have enlisted HR supports assistance with that, and they have agreed to take that on. So we've given them the list of all of those facilities, and they're working with OES, and they're working through logistically how they're going to do this facility by facility. So those facilities were actually left out of the heat map that I showed you purposefully because we knew they were going to be vaccinated.
Thanks, Dr. Let me move on because we have a few more questions, and again, I don't want to, take all the time here. But being at the pod here this week or last weekend, and the next pod will be, I think they were told me 13th through the 15th or 14th or 15th or somewhere in February, in that time frame. Knowing that we do have, vaccines and we need to get this out as quickly as possible, why are we having such a long wait in between?
For that second dose, that's 28 days post the first dose for Moderna. I think
that's just for second dosers.
Correct.
Okay, can we do something like that for, 65 and older, something of that magnitude, so we can get people in there and not just have it at one centralized location like at the Ag Center, but, maybe in South County and, in the north part of the county. So we don't have that rush, and for those that are 65 and older or vulnerable population that can't travel to Stockton, we can put it in, their areas.
So I would say HR support, who's doing 20 static testing sites, they're on the cusp of being fully approved. So all of those static testing sites, they can also be a partner for vaccination. They will also do mobile testing sites, mobile vaccination sites as well. But the rate limiting factor is getting additional doses. We might be at the point where come February 13th, when you're supposed to come back for your second dose, we might not have those doses available at that point in time.
But as of now, we do have doses that can go out, and what I'm trying to get at is to get these doses out as soon as possible. And correct me if I'm wrong, and this is something I've heard over the weekend in relation to who's can give the vaccination. And what I was told, and please let me know if this is factual, was that you have to be certified. So, because I talked to a doctor's office over the last week, and he was asking me hey, look, I'm a doctor, I have nurses, we have approximately 10 people here, all of them can deliver shots. We do it with the flu shots and, whatever other shots there may be, versus going to a pharmacy when you have 1 or 2 people that can deliver the vaccine. So I put that question to, I can't recall who that person was, but what I was told was this, that everybody, even though you're a doctor and you went to medical school, they're not per se certified. So what they need to do is contact public health, county public health, and county public health has to contact the state, and then the state has to put them in a database, and the state takes several weeks in order to get them certified in order for them to give the shot. Is that correct?
This is the difficulty, is that we have some retired nurses and doctors who want to volunteer and be vaccinators, but there is a process, and it starts with HR. And I don't know all the details of who does what, but I know that it gets sent to county HR for processing.
But isn't that just, when we're trying to get out these vaccines as quickly as possible to save people's lives,
Yeah.
and yet we're having a bottleneck because of some bureaucratic nightmare going up in Sacramento. Is there something that we can do here at the local level to prevent that or stop that? Or just,
I think public health chimes the state basically daily. It'd be nice if the state worked weekends to get this backlog done. It took us a lot of advocacy to get some of our partners approved in the CalReady, CalVac system. Now we're waiting just for them to be issued an ID into the CARES registry, which I think is just ministerial, but it is a limiting factor that we can't get other people stood up at this point in time. It is too much bureaucracy at the state level. I know last board meeting, or maybe at the beginning of January, I mentioned at that point in time, we only have 25% of the vaccinators approved currently than we did during H1N1.
But I understand you're just kind of reiterating the problem that we know exists, but is there something that we can do to fix that so we can get more people vaccinated, more doctors, more clinics, to administer these shots in order to get more people vaccinated?
I think there's a good CSAC letter issued today to basically force the state. We need the state to move and get rid of this bureaucracy. I know public health can speak a lot more to it. The back and forth and just the micromanaging, days, weeks to get somebody approved that's already a certified licensed healthcare provider.
It's just amazing, well, it's on that note, but I'm going to jump into the incident command system real quick, Chair, with your permission. Now, per San Joaquin County Emergency Operation Plan 4.2.1, Emergency Services Council, and I believe Director is that Marcia Cunningham is the chair of that. Can you can I direct some of these questions to you or your staff?
Good afternoon, Chair, board members. Marcia Cunningham, Director of Emergency Services, Shelley Lemos with me, Director of Emergency Operations.
Thank you very much for both of you for being here and for coming up here. I do have a couple of questions on, the Internet Command Center going through SIMS and, the NIMS that, we all should be following. Now, I asked these questions on, I believe, on January 13th, I submitted correspondence to the CEO requesting confirmation that our Department Operations Center were operating and complying with our emergency operation plan. And in order for our Emergency Operations Center and the Joint Information Center to operate effectively, all relevant departments must participate fully in the requirements laid out by the EOP and related appendixes and annexes and so on. And I didn't get the answers I requested through those questions. So some of these questions I want to answer now. Now, which departments have activated the DOCs for this pandemic?
Public Health.
Just Public Health. Now, so
And we've also declared an emergency.
Right. So okay. All right.
And the EOC is activated.
Okay. Now,
Activated so where there are requests as it relates to helping coordinate logistic events, supplies, and so forth, that those requests come from people like Public Health or EMS to us, and we will assist with providing that assistance like we did this weekend at the event that was set up.
Okay. Now, are the DOCs operating and complying with our EOP, and specifically proper interaction with the EOC and the Joint Information Center?
I think that would be a better question for the Department Operations Center staff to answer.
All right. So who is the incident commander of this operation?
Perhaps we're getting a little bit confused. Can I clarify? Emergency Operations Center, the EOC, is the county system that comes under OES. Mm-hmm. Department or DOC Operations Center is an agency-specific center, which would be, for example, the EMS agency has their own Department Operations Center because they've been coordinating activities that are specific to the EMS agency, and the Public Health Department has a Department Operations Center because they coordinate activities specific to Public Health Agency. So the EOC would incorporate all of those activities. And if you're asking if they're participating, they do coordinate with us, and we have had conversations, and they do participate in our weekly situation briefings.
Okay, so let me see if I can simplify this as much as I can. You're aware of the SIM system, right? And the incident commander. So who is the overall incident commander in this? It has to be an individual. Is it OES overseeing this, or is it Public Health?
Public Health. Okay. The medical health emergency.
So when you're looking at the SIM system, any resources or information or anything that is needed going through Public Health, not OES, Office of Emergency Services?
Actually, logistics and things that go to the state go through OES. The Emergency Operations Plan outlines that depending on the type of an event, that different departments might take the lead because of jurisdictional authority, and in this case, Public Health takes the lead because of their jurisdictional authority, and that's outlined in our Emergency Operations Plan in a matrix that shows what the primary and secondary agencies are. OES is considered a secondary agency as far as that piece.
Okay. When you have a unified command like the Incident Command System, so who's empowered to control and direct the efforts of all these different departments and emergencies personnel?
So in this perspective, from a public health perspective, from EMS, it's Dan Birch. From Public Health, it's Ziana Blackwell.
All right. You know,
From the EOC perspective, it would be Shelley. From the operating perspective.
you know, I'm going to, you know, I'll just look. What I want to know is, to me, just looking at, you know, what I'm hearing now and the incident command, the SIMs, it just doesn't seem like there's a clear picture. You know, who's in charge of planning, who's in charge of logistics, you know, who is the main person in which it all runs to, who is the person who is giving direction. And because what I'm trying to find out is that in order to operate, to have incident command systems to operate effectively, there has to be coordination among all our agencies here in San Joaquin County. And before I came out here today, I was told that OES was in charge, and now I'm being told public health is in charge. So this gives me very much of great concern. The concern of so much that how are we being as efficient as possible in getting these vaccines out there to be delivered to our population? You know, I'm going to have one more quick question, and I know I'm going to hold up for additional questioning, but it is my understanding that Public Health Services receives funding from the CDC through the state for public health emergency preparedness planning and has a plan for the dispensing of masks in its prophylaxis, is PROPHLAXIS.
You're correct.
And to the entire population within a short period of time. Now, I know vaccination and pills are different and how they're administered are different, but why hasn't public health activated and implemented the appendix on 4.1 of the PHS the pod plan, if we already have that plan in place? And it would, if it's pills, why couldn't you do it to vaccines?
So if Greg or Dr. Park want to answer that, that'd be great.
Let's respond to that. But again, the limiting factor is the amount of vaccines coming into our county. And I think to your point about NIMS and SIMS, it's one of my frustrations. There is not a single individual in the county with plenary authority to drive budgets, to drive personnel on this response. It's been a public health response, an OES response, an EMS response, a county clinic hospital response, but there has not been a single entity. I mean, public health is doing a lot with Dr. Park, Zena Blackrod Rodriguez, but there's not one person at the top of an org chart over all of the county response.
And that's what I was trying to get at. So, Ms. Dietrich, can you stay up there? Do you see a problem with that? How do you expect SIMS to work? I mean, it's planned for, it's without having that person, that incident commander at the top, is planned for failure. I mean, there's a reason that, you know, all emergency agencies throughout not just the state of California, but even follow NIMS throughout, you know, the country follows this type of system, and it's been tried and true. It's been used for campfires, you know, the campfire, for example, and pretty much, you know, every major disaster here in California. Why aren't we following that?
I think to a large part we are. It's just I don't think there's one unified command with a named incident commander.
Ultimately, it is a unified command, and we share the responsibility between us. OES is handling the logistics between the state. We're responsible for requesting resources that are not public health and medical. There is a public health and medical mutual aid system, and they go through that system. It's a little bit different when it becomes public health or EF8 and OES. They have their own system, much like fire department does. And so the fire department, whenever they respond to an incident, they don't go through OES either. So they have their own mutual aid system. So we have been working together. OES has been handling logistics. We're handling a lot of the finance and the recovery as far as grants and getting recovery back from FEMA. and tracking, and also the Joint Information Center.
Okay, and I'm going to end it at this. I just want assurance that we're doing, everybody, every department in this county, every member of this county, every agency in this county doing their part to ensure, they are conducting, the required activities. And this includes, our cities, agencies, our community organizations, whatever it may be. But this board, needs to be made aware of support that is needed, issues that need to be corrected, and it seems like there might be some here, and activity taking place that we can assist in, public awareness and acquiring resources needed in order for we can, be as efficient as possible and get our residents vaccinated. And you bring up a point too, and like who is our, that's the last question, I promise, Chair. Who is our lead PIO on this, a public information officer? Because the reason I ask this is, there are several locations, like on our county website, where various COVID-19 pandemic information is available. Some find it confusing. I myself find it confusing because I look on that just like anybody else who get information. So is there one person in charge of relaying this information out to the general public?
We have a joint information system that is participated by public health, EMS, and several other county and other agencies that participate then together. Jolena Voorhees is one, and they meet almost weekly right now, or maybe even more frequently than that, and they coordinate and collaborate together on common messaging. So they work closely with the risk communications folks at public health to get a good message from public health that fits the needs. And they work with the CAO's office through Jolena to make sure that that message is acceptable. And they also work through our management at the EOC director level to make sure that it fits our requirements as well. So in my office, Tiffany Heyer is our appointed Joint Information System coordinator for our office. So we do have a single person that's coordinating that effort. However, they are working together.
All right, thank you. And Chair, I'll relinquish my time back to you.
All right, thank you very much. Next, we have some questions from Supervisor Miller.
Thank you. I'd like to go back to some of the vaccination numbers. So perhaps Dr. Park might want to come back down, and Mr. Diedrich, you as well, to have some questions for you. I want to make sure that we're clear on some of this information. The numbers you stated said we had just under a total of 17,000 vaccinations that have been administered. And then we have approximately the same number left, correct?
That's correct. In the beginning, we had vaccine, coming in and going straight away to our acute care hospitals, the 7 of them. On the 15th and the 16th, they got their first doses. And every week we ask them, what more do you want? Because we deliver twice a week. And in the beginning, it was just those 7 hospitals vaccinating their own staff. And over time, they've each received many shipments of Pfizer or Moderna, whatever they want, and we've taken out to them as they felt they were capable of vaccinating their staff. And I believe that most of the 7 hospitals are pretty much finished getting to anybody who wanted it, down to the janitor and the cafeteria worker. So we gave all that they wanted, and there was still some remaining. We wanted to give more out, but we were waiting for the state to approve other people to be vaccinators. Finally, we got an approval for CMC or FQHC. They were the first after the 7 hospitals. And then we gave them vaccine, and they vaccinated their own staff. Then they've moved on to helping by vaccinating, as I said, St. Mary's Dining and the dialysis centers. So as each entity gets onboarded, we give them enough to vaccinate themselves, and then we start asking them to help us with the community. Soon after CMC, it was San Joaquin County Clinics, so not the hospital side, but the clinic side. and they were vaccinating Monday through Friday 120 doctors and dentists and other medical professionals a day, but that literally just started a little bit over a week ago.
Right.
So we waited for these approvals before we could dispense the vaccine. And now we're in a position where we could really ramp up because Safeway literally just started last week at 5 of their pharmacy sites. We released their phone number to the remaining healthcare providers that still needed vaccines. And then we're working now on Save Mart. We're about to onboard HR support. We're really in a phase where we're ramping up, and we can foresee ourselves getting through the remaining vaccines very quickly and then not having any and to continue, which is the problem.
So that's what I'm getting at. The amount that the 17,000 that we distributed, that was one dose, correct? That's a total of 17,000 shots.
Exactly.
Correct. And I'd also like to point out that is an undercount. That's only the 17,000 is what is in the immunization registry. A lot of our partners that we've allocated have probably vaccinated, but it's not in the registry, so we can't count it.
And so if we have that many that have already ended up in arms, and we've got the same number in reserve, we don't have 17,000 that we can send out right away, correct? Because that first group of folks that got their vaccines, they're going to need their second dose in about 2 weeks?
In
about 3 weeks
out
between?
Of the 17,000 number, the 16,909, about 4,000 of them were already second doses. So then you've got maybe 12,000 remaining that are counting on second doses. We were told, don't hold what we give you. We will give you an exact match every week to what you got prior, 4 weeks before if it's Moderna, 3 weeks before if it's Pfizer. Now we can't rely on that because the federal government is telling the states you can no longer rely on that. We don't have second doses in storage anywhere, which we thought we had, and now we're being told to keep our second doses. So it's very challenging to know how much do we keep when we don't know how much we're getting next week. So we have been trying to get it out. We haven't been, until last week, we weren't really trying to keep second doses. We were trying to get it out. However, the limiting factor was who could use it and who could vaccinate. We gave as much as every clinic thought they could do and use.
And Dr. Park, clinically, it's a minimum of 21 days for Pfizer and 28 days for Moderna, but that's a minimum. There's not a maximum for the second dose.
So you want to get it 21 days, 28 days, maybe 4 days early is acceptable, maybe within a span of a couple of days after is also acceptable, but there's no hard end date. So if you're 2 months later and you haven't received your second dose for some reason, you're supposed to go ahead and get it and count that as your second dose. You don't restart the process. So there's no hard final date. So there are some folks thinking one dose is better than two and get it into more people because at least there's some efficacy from one dose. Don't worry about the second. That's not what the state is advising us to do.
Yeah, my reading says after one dose, after a couple, depending on the type, maybe you get up to 50%. And so it's not until 2 weeks after your second dose that you start getting up into that 90+%. And even with that, I mean, this is brand new, so not all the data is in. We don't know for sure. So on a worst case basis, if there is a holdup, we have enough in reserve to make sure that those 12,000 folks who got dose 1, there is enough for their dose 2. That leaves us with still about 5,000 that we could immediately get out if we get on it, correct?
I think some of those doses include the Moderna batch that we're holding right now. Hopefully the state clears that up and we can move forward with that. But I think the positive news, we are on the cusp of being able to vaccinate maybe 5,000, 10,000 people a day with our capacity. I just need vaccine.
Okay. So here's my question. Mr. Diedrich, you were talking about, and Dr. Park, you as well, wanting to, if what we want is to be able to reopen and start getting our kids back in schools, our businesses back open, that we're going to need to be a little more targeted, perhaps, in terms of hitting the highest risk population that are more likely to use up those hospital beds, need the ventilators and the ICU beds, that sort of thing. So if you're going to target these areas, I mean, you've got this great data with these heat maps. How do you think, given what happened this weekend, how do you think you're going to prevent the minute word goes out that you're doing a vaccination for folks in a certain neighborhood? How do you think you're going to be able to limit to that neighborhood? And if you go in there with 2,000, because you've identified there's 2,000 very high-risk individuals, and 8,000 people show up, I mean, given what happened this weekend, many of us, our offices, were being very responsible about the information we were putting out to the public. We were telling people these were events for our IHSS workers, and then we were bombarded all weekend at home by neighbors, friends, individuals, some of whom were in their 40s, saying, "You're crazy. I went out there, and yeah, I had to wait for 4 hours, but I got vaccinated." So how do you, I mean, you talk about, there were concerns we're trying to get over with our equity, high-risk communities to build trust and make sure that they show up for these events. How on earth do you plan to address that, given the fact that all over social media this weekend, people were high-fiving one another? Hey, I got my vaccine because I got a phone call from somebody who knew somebody that was volunteering at the county's Max Vax event. And how I want to know how, if you're going to target vaccinating, how do you intend to enforce it? Because otherwise, you should just say everybody over 65, you got to sign up on the county and get a time block, and you should expect to spend half the day sitting in line and getting your shot. I don't see how you can do both, because right now, the general public, they don't feel like this weekend was a big success. They feel like all the things people have been telling them for months, oh, you wait. When those vaccines become available, it's all going to come down to who you know. Those are going to be the people that get vaccines first. And that's exactly what they saw with our first Max Vax event. And I'm not trying to put the blame on any one entity or one group. There were a lot of people that showed up to volunteer, and I appreciate that. But we need to learn from this event going forward, because whatever trust we've been trying to build with a lot of these very hard-hit communities, I would venture to say those were not the communities that got the word and were showing up at this event. So my question is, what's our plan? Are we going to target, and are we going to work toward what will be the most effective way to reopen? Or are we just going to say, we can't manage this because of the state, which, believe me, that's a very legitimate position to take, given the way the state has failed to listen to public health officers up and down this state, and just say, we can't do it that way. We're just going to open it to 65 and over, and we're going to, you have to sign up and get a time based on your last name for a certain date.
And Supervisor Miller, I accept that criticism. I think we need to move to a vetted registration system where we target these individuals, reach out to them, confirm their identities, give them an appointment, and enforce that only people with appointments get vaccinated unless we have excess doses. I think this weekend was a good learning exercise of how we can successfully do a mass vaccination event besides the other people coming that weren't at the target. I think it was successful for a proof of concept of how we can do it successfully. But indeed, we need to limit and target those. But challenges, we don't have enough vaccine. And if we just open up to the 65-year-olds and we set up a portal, the next complaint is I can't get an appointment until June.
Exactly. Exactly. And we've seen what happens in other states when they just throw it open, and you have, 80-year-olds sleeping in cars or on the sidewalks waiting to get in line. I got emails from 80-year-olds over the weekend saying if I had known, I would have been there at 6 a.m. and I would have waited in my car for 6 hours. I just think it's really important going forward that if we make a plan, then we need to enforce it and we need to stick with the plan, because otherwise nobody believes what we say. Yeah. And the way we communicate, we're going to have to expand that, because if the targeted highest risk population is over 65, that's also the largest population who either doesn't understand the internet, doesn't have access to the internet, doesn't do social media. They get their information from other, sources. We have to figure out, how do we communicate better? And if we think it's just going to be people coming to our website, that doesn't work. I can just tell you, our phones are going to continue blowing up constantly with a whole bunch of people who are in very genuine fear for their lives. And and I know you know this, it's a hard place to be when you've got some vulnerable seniors and you're talking to them and they're crying and they're terrified and you're saying what you've been told, and then it turns out that what you've been told is not accurate. I mean, I feel like, and I know my staff does, we feel like we lied to people over the weekend. And it's a really uncomfortable place for us to be. And it's really hard for us to ask our staff to continue putting themselves in that position on our behalf. So all I ask is, as we go forward, recognizing this is very difficult and very complicated, we need to come up with a plan. I think that's part of what Supervisor Rickman's getting at. There's got to be a plan in place with a chain of command that we can go to and have absolute assurance that the information is correct and that what's going out to the public is correct. We need to know that going forward, what the county says we're going to do, that's what we're going to do.
I'd agree. We do need to do a lot more messaging, and I don't know if we can talk openly about what might be announced on Thursday, but it's going to throw a severe wrinkle into our plans.
I agree, and I think the one thing we can count on is that the state is going to continue to pivot back and forth based on political expediency at the state level and without any real concern for what goes on with the frontline workers who are here trying to actually vaccinate the millions of people in the state of California. And I think that's something we should just count on, because I don't see that changing anytime soon. Thank you.
Thank you, Supervisor Miller. Understand the frustration, and I will tell you that I was equally frustrated. Public Health released the vaccines for the purposes of vaccinating IHSS workers, and unfortunately, some of the word got out, and it wasn't our intent to have an event that had not been publicly advertised and shared with everyone so that everyone had equal knowledge of an event. Moving forward, my plan is that I would only like to release vaccine to mass vax events when there is a registration system in place. I don't want 75-year-olds, 80-year-olds sitting in a car for hours or standing outside, camping outside on camp chairs when there could be an appointment. You show up to your appointment and you get your vaccine and you go. So we're definitely looking into ways we can organize this better. Who we invite to get that appointment, that is the next challenge, and that is the reason for looking at heat maps. I've talked also with Director Woods from HSA. We're looking at senior centers, where a lot of these community centers where a lot of our seniors are getting free meals. Can we target that population? Can we target the population that receives Meals on Wheels? and he's willing to work with me to get some semblance of a plan together. And as I said, the heat map was just generated, and we're sharing it with OES that helps us with logistics. So we're trying to find within those heat maps where would be great places to put this, and then invite the people who live around that heat map to that center for a vaccine event or to that high school site. So there's some work ahead of us, and I understand the urgency that we have vaccine, and I do understand Supervisor Rickman's urgency to not sit on it. The event that was just held was run by San Joaquin County Clinic staff, and they work Monday through Friday. They can't do it for us every single weekend. They'd be exhausted. There's just no way. But they did supply many people, 30 vaccinators from medical schools, plus 10 of their own nurses. And for me to find that situation again by this weekend is a challenge, but I agree that we should be having events every weekend if possible. We need other groups to step up and be willing, because we can't use the same group weekend after weekend. They're just not able to do it. They already are working Monday through Friday, and they were exhausted after the weekend.
Right. I mean, if we're going to say you need to be registered, then people need to show up with the way we did with the testing. You were supposed to show up with it either on your phone or print it out, but you had to show up with something that showed, yeah, I'm supposed to be here, in this is my time frame. If the minute we start saying, oh, we'll just go ahead and come through, the minute we start doing that, those people are on their phones and they're texting and calling their friends saying, they're letting people in. Go ahead and come on down. That's how that all works. And so it's either got to be one or the other. I don't think we can make it work otherwise.
Agreed. Thank you.
Dr. Park, I have a quick follow-up question before we get to Supervisor. Vice Chair Wynn's going to have some questions for you. You had mentioned a registration process. Do we have a mechanism in place for registration?
So our IT staff looked into it, and they have purchased a system called Sign Up Genius, which I'm told is activated and can be used now. It was something we just purchased last week. It's a simplistic registration system where we can invite people to get on, make their appointment, give them a time and a clinic. And we can do this for separate clinic sites. So if we have 3 separate clinic sites on the same day, we can invite someone to register for one clinic and another group to register for another clinic. So we've got HR support over here. We've got Joan Sing Song from San Joaquin County Clinics, who's very familiar with testing. She's going to maybe pivot and do vaccination. We've got her going over here and then another clinic going over there, and we will be able to build that out that way.
So, and this works, you said, by invitation to register?
So that is the intent right now, is to perhaps focus on groups based on the maps, based on maybe conversations with our health plans to see who might be most at risk. It is something that has just been purchased, and we need to utilize it. So we're doing trial runs amongst ourselves right now, but it's the system we plan to use. It's called Sign Up Genius.
Okay, and I'm uncertain how that information is being shared, and if a person can sign up and be qualified. I really don't know. But I know last week during a phone conversation with the Urban Counties Coalition, I was absolutely speechless when they were all talking about the registration process and the vaccinations they were doing. And I had to ask, I'm like, excuse me, we're waiting for the state, we're waiting for a whole, we're still waiting for the mechanism of sign up. And several of them chimed in and said, Othina. It's an app, it's downloadable, you can get your time, your place, you can get your reminder for your second appointment. It's an easy system that people sign up for. So I don't know if we can do that in conjunction, if this new system that we've purchased is better. I'm a little bit concerned on the invitation part, how you're going to reach masses of people when at some point we're going to need to. So there may be a comparison and maybe a benefit of incorporating more than one mechanism of registration, but I know that I've not heard anything about it, so I can't share that with anybody. So that's one thing that I believe we can utilize and get out to the public. Supervisor, Vice Chair Wynn, you have some questions?
Yeah, thank you, Chair. Along those lines, the question arises, and I think all of us were probably out there at one of the events, but one of the things that always strikes me is the administrative part. It's the paperwork. We have little cards that are required that the patient gets. We have another document that we keep for follow-up, et cetera. There's all kinds of paperwork. Then the registry on top of that. And every time we're entering information over and over again, which unfortunately not only takes time, but it can be errored because, you don't necessarily, especially a complicated last name, et cetera. And I think we've been using, I don't know, Greg, you would probably know, I think we've been using some forms of that particular brand of software. At least I've heard it before, so I'm not sure where it's been in place, but there's a variety of them. Anyway, the reason I follow up on the chair's comments is it would seem to me that well, first of all, I certainly appreciate the efforts that were taken over the weekend in regards to all the volunteers, all the agencies that were participating, certainly with traffic control and administering the vaccine, et cetera. One of the things I was struck by, it isn't like, my comments in the past, it wasn't like we could just, line people up and give them a shot and send them on their way, because it is involving, obviously, the temperature, the time by which it's administered, observing the individual at least 15 minutes, all these things, and they were doing, 6 stalls at a time with 12 stations. So I appreciate the effort. I thought it was a good trial, so to speak, on how we can do in the future. But the other part of it is the traffic was backed up to Airport Way. And, like I say, people were waiting 3, 4, 5 hours. So obviously that creates additional problems. But I think that one of the things we can look at is, because volunteers, as great as they are, sometimes are not dependable. So that becomes a problem if you expect a certain number of people to show up for a particular task, and they don't. It kind of puts you in a negative balance. So I would look at a couple things, maybe with Director Cruz as far as ISD, but it would seem to me that we could reduce the amount of administrative time. And for example, this is another point, but this is Stanislaus County, and I don't know about my fellow supervisors, but I get a lot of comments or complaints from my constituents saying, well, Stanislaus County can do this, or Fresno County can do this, or whatever. Why aren't we doing this? And it's interesting because when we talk about the different tiers, on their particular website with this particular, which we all have, they have a little addendum where they added the 65 plus. But it's kind of interesting. But the other part of it is that they also have on their website, they have total doses allocated, and then doses allocated to healthcare providers, and then allocated to public health. They have the information on the website. I get asked that question. I can't answer it. And so I guess my question in regards to our website, or at least transparency and communication to the public, when you made your presentation, Dr. Park, you listed all these various agencies and entities, but the one that was missing was the public, and that's priority one. We need to communicate with the public, and I appreciate your comment, Dr. Diederich, in regards to, what can we release, et cetera. Just basically this presentation, it should be out there for the public to watch. And more importantly, we need to revise so that everything that's available is out there on the website. Now, public health, and I don't know, we've talked about, public information, but when I look on the public health website, the last press release I see out of public health is in November. Now, maybe that's the last time we did it. I don't know. But all I'm saying is that, we need to make sure that our websites are up to date. And we also, because we're talking about this, we need to make sure as we develop these plans that people can go on and look and see what's happening and what the future holds. When you talk about vaccinators, for example, the question is, I know where we are now, and I appreciate certainly the recruitment of a variety of agencies or entities. But one of the areas that we've talked about kind of indirectly on other issues is our fire service. For example, I know we've talked about as far as some of the skilled nursing facilities, using paramedics, et cetera. So my question just along those lines is, are we recruiting or utilizing either paramedics or EMTs as part of our planning process to set up maybe smaller pods, or so to speak, locations where we can whether it be for my district, Linton, or maybe Thornton or whatever, some of these more outlying areas. Have we reached out to the fire service to bring them in with their medical experts, so to speak, to participate in these particular vaccination programs?
I can maybe invite Dan Birch to come down. I know that Lathrop Manteca was part of the early planning for the events this weekend, but it ended up not being part of the actual vaccine team. There are some requirements for paramedics and EMTs when they vaccinate, if they have to have what type of oversight, and it also gets back into the CalVax and who employs these individuals as well. But I know there is some dialogue. I know Dan Birch had some additional dialogue with some of our paramedics. They are approved, but I think a lot of what they're doing now is in the hospital setting. They did some mass vaccination when AMR had their first pod back in the third week of December. But maybe Dan would be more able to directly answer that question, Supervisor.
Well, I appreciate that. I guess my point is that it would seem to me, as we're developing, and this is going to be a long-term project, we're not going to do it in a month or two, but it would seem like we would recruit or collect as many potential vaccinators as possible. We may not use them, but certainly in the event, and I appreciate the information you sent me in regards to, 30,000 a day statewide that we hope to reach at some point. I don't know what that equates to in our county, but we're talking about a lot of vaccines. And when we talk about the numbers that you have currently certified by the state, and I guess this would drive me nuts, are other states requiring all these hoops, to jump through in regards to, getting the vaccine out? Because, I was looking at some statistics in regards to, and I just picked 4 states, just off the top of my head, because California and New York are obviously some of the most talked about, and Texas and Florida are the other ones. The total number distributed in California, we have 12% of the doses distributed in the entire United States. It's over almost over 3.5 million. And yet the number that we've actually distributed per 100,000 is a little less than 9,000, but the actual ones administered is 2,700. And when you look at the other states, even though they have maybe a lower distribution rate, they're all close to 4,000, and that's per 100,000. If you multiply that by a population, that's thousands and thousands of individuals who've received the doses that we haven't, even though we have the most in our state. I think we're at the bottom 10 in regards to states as far as administering it. And my question is, and I know this is not for you, but my question is why? Why is California so micromanaged happy? Because everything we do has to go through some type of committee or some type of certification. And cards, you need a card? I mean, once you've been certified, so you don't have the card in your hand, so what? I guess my concern is that we continue to add more and more layers of bureaucracy when in fact the population that we deal with wants it now. And they don't care about this. They just, obviously they want to be safe. Getting back to what Supervisor Miller was talking about and Supervisor Rickman, I don't think we can do a public event per se when I say that, because as happened this last weekend, word gets out, you're going to be buried in people. There has to be a process. I bring this up all the time, Disneyland versus Disney World. Disney World has been open for months. Why can't Disneyland open? Well, if you look at Disney World, you have to have a reservation to get in, all right? It's a simple process. It would seem to me that if you want to go get vaccinated at a particular location, near your home or wherever, that you would have some type of document that would give you, a free pass. And if you don't have it, you can't come. So I think there's a lot of planning. I'm sure it's sort of, Ms. Henry, we've discussed this, I'm sure ad infinitum in regards to how we're going to plan this, but I think we need to move forward. To address what Supervisor Rickman was getting at, and he and I came from the same, basically, world or culture. In SIMS or in things that we dealt with, there was always one person that was in charge, usually the agency responsible for that particular event. And they made decisions based upon all these agencies that were participating. And I guess, I understand this frustration, is that we don't necessarily have one person. Dr. Park, you are overwhelmed, and you can't be calling shots or public health. And neither does, this kind of. I was probably one of the last supervisory chairs, that was the director on these OES type events, floods back in 17. It was a daunting task. I can only appreciate what Chair Patty is dealing with, because when you're the chair, there's a ton of things that go beyond what individual supervisors do. And so that was eventually transferred to the director and others, because the supervisors' inability to handle that and their regular duties. But the one thing I would add is during that time, I was engaged. I had an opportunity to certainly to deal with all the departments, et cetera, go down to the EOC and watch what's going on, talk, et cetera. And I think to some extent, and this has been the criticism, but this is kind of lacking right now. We don't have a person that anybody can go to with an issue, and they can reach across all departments, both in the county, cities, wherever, state, and they can really, be the glue that holds that together. And I think that's concern. So again, I think there's things that obviously we've learned. There's things we can do. I think the potential is great. This isn't going to happen or go away in a month or two. So we do have an opportunity to spread this out. I would offer this, Chair Patty, because I know Supervisor Rickman, I know he has a lot of questions, and so do I. But I would offer, and I don't want to drag Chair Rickman or Supervisor Rickman in this, but I would offer that maybe the two of us have an opportunity to work with what's going on with OES and all those, and not to run it. I'm not talking about taking over, whatever. I'm just talking about an opportunity to work and have both of us see on the ground what's going on, and if nothing else, be an intermediary to the board, and certainly make sure, because I'll be honest with you, and you all know this, where you sit, you have a different perspective where I'm sitting as opposed to where you're sitting. And I'll tell you, all of us been buried in emails and calls and just conversations. And so there are some things that I would want to see done that I'm sure it's not, in your wheelhouse, so to speak, because you're dealing with your job very efficiently. But I think there's opportunities for us maybe to add a little bit perspective, and certainly to listen, and if nothing more than at least running it by a supervisor and asking a question, because Supervisor Rickman and I probably have a good awareness of what the board's concerns are, because we're all dealing with the same issues. And again, just try to provide if nothing else, a sounding board, certainly somebody to contribute, and more importantly, somebody to listen, and then pass that information off to the board. And not just the board meetings, but I think, almost on a weekly basis. So these are all things that I think would improve what's going on, because I think we're all, as we hear all the time, we're all in this together, and that's true. And to be honest with you, I'm tired of getting emails talking about other counties and how great they are. I've been down that road, obviously, with the closing of businesses. I followed up with supervisors in those counties. It isn't the way it's perceived. There's always, an asterisk, so to speak. So what appears to be, opening up and thinking, it's never that way. And so I just want to make sure that we're doing the very best. And I think, as Supervisor Miller talks about, we have to, if not regain, but certainly maintain the credibility and trust of the public, because this has been a wild ride. And I didn't even get into the emails I get on the businesses opening. That's still a real hot topic. And I'll only mention this, but Stanford Medical came out with a study over the weekend in regards to lockdowns. I won't go into it, but it's a very interesting read in regards to their findings as opposed in the 10 countries that they survey. So my point is, I would offer, and I'll leave it to Chair Patty, but I would offer that Supervisor Rickman, because maybe of our interest in our backgrounds, and I sit on several healthcare committees, that it would be interesting to kind of interact with what's going on and get a better feel, and report back to the board and give the rest of the board members a better vision of what's going on, so that we're all kind of on the same page. So with that, I'll leave it at that. Thank you, Chair.
Thank you, Vice Chair. County Council, and this may be a question to Ms. Cunningham as well, but County Council, what is the mechanism to mobilize our emergency response? Like as Vice Chair Wynn is talking about when we had floods, We activated agencies. We put together a protocol. What is that mechanism? Do we need to declare something in the county to mobilize anything?
All of the declarations that need to be made have been made. Those were made back in last March. The situation that you have responding both to Supervisor Rickman and Supervisor Wynn, and really all of the comments about what is the hierarchy and what is the structure here. This is a public health emergency. It falls under public health as was discussed. The structure that exists within the county family is that both public health, EMS as the Mohawk, both answer to Greg Diedrich as healthcare services. So if you want somebody who is the focal point, who can answer and give direction, that's the person that you can give that authority to. If he's needing additional authority, he's the person who is directly supervising those two departments. They both answer to him. In addition, you've got OES, who is providing that logistical support, not only logistical support within the county, but throughout this emergency, they've been providing logistical support and communications and coordination amongst all of the cities and agencies within the county. So I think all of the organizations exist, all of the orders exist, but to the point that's been made here about the absence of that person at the point who's going to be able to make the directions and make the decisions. Yes, that has been absent. Greg is the natural person, I think, structurally within the county hierarchy, if that's where you want to place it. Having an ad hoc committee, that is certainly within the power of the board as it's been agendized today, if you wish to appoint an ad hoc committee also.
Well, Vice Chair Wynn brings up a point. As chair, I would also like to be engaged. So if we were to put together an ad hoc committee, Mr. Dietrich, the conversation really is what to facilitate and how to maximize and how to increase whatever we're doing so that it's more of it. Communication, awareness, distribution, mobilizing, whatever. I know that there was a conversation, and we've talked about now the SEMS. I believe I'm saying that correctly. And at one point, Sheriff Withrow had volunteered his level and his department of expertise and that they mobilize. And I cannot think of an agency more equipped than the fire department. I mean, they mobilize. The military comes in and studies how the fire department mobilizes and gets thousands of people into a perilous environment and support services and all these other things. So what would help accentuate, because there's so much riding on, your plate is full as it is, as all of us. We're all busy doing a job, and I want to compliment. I know that everybody is prioritizing this, and we're limited by the number of what's brought in. It's a constantly changing environment, and there's a lot of things a lot of mechanisms that make this difficult, that are outside of our control. But what can we as a board, as I always ask, what can we do more of? What can we do to accentuate success?
I think more resources, and indeed I am over EMS and OES, but I'm not over the rest of the county. We have disaster service workers that were put into this fight, and I think COVID response is the county's #1 priority. But early on, we got disaster service workers that were given to us that were under performance improvement plans. A lot of those disaster service workers in the lull, if you will, in June and July, were pulled back and were not replaced. What is the county's primary? Is it filling potholes? Is it other ISD projects? I don't have the planning authority and the spending authority to marshal resources that are not a part of healthcare services. As Supervisor Wynn mentioned back in the flood fight, at that point in time, the chair of the board was, in essence, the emergency authority, if you will. It's a little bit bifurcated right now. I definitely need I appreciate the boards wanting to come alongside. We struggle. Dr. Park is the only physician that's full-time within public health. We don't have an assistant health officer that's been vacated for a year and a half. We don't have a CCS medical director. I think our head count for full-time in public health right now in filled positions is 199. The allocated positions around 220. That's probably 50 head count less than we were in 2008. We don't have a lot of bandwidth. And we, to some degrees, struggle. It's a day-to-day issue of what we can get done. Obviously, I think we've been successful on a lot of fronts. We need a lot more public communication. I am a little worried, if we go out and we say, the 5 Safeway pharmacies are authorized, does that mean, people just heard that and are going to Safeway pharmacies, and are those pharmacies going to want to back up because it's causing, issues at their sites? But no, I think we need maybe, and we had a meeting with Assistant County Administrator Matt Palin this morning. I think we need to have more of those high-level meetings where we all can get together, understand what we're each doing, that shared information, shared communication, that we all have our individual marching orders, and that we are not duplicating, or that we all have a shared mission.
Okay, so question for you. Would you feel most comfortable bringing in somebody that can help you and facilitate and be that lead person that helps you execute all the things that need to be done, that organizer, the one that delegates and that, as Vice Chair Wynn and Supervisor Rickman are talking about, that SEMS, that command hierarchy, it seems to be missing. And so, as County Council points out, I mean, this is kind of resting on your shoulders. What can we do to enhance? Do you want this responsibility, or do you want to bring in an agency that has experience mobilizing and activating, as you have seen in the past during floods or other critical environments?
Well, Dr. Park, as a health officer, has a lot of the authority. I cannot supersede her authority as a health officer, but we could use more resources, most definitely.
Okay, and this isn't superseding anybody. This is bringing in a hierarchy of command so that we have an actual command center. We have people that are helping you delegate out, organize, and enhance the response. So I think that's what we're looking for, and I believe we should activate the SIMS model.
And I think we have a unified command. There is a lot of SIMS going on. I know that we're going to have recurring meetings with via Matt Palin. I appreciate the county administrator's office coming alongside. To be frank with you, it took us 3 months to bring the ELC CARES Act grant to the board to allocate 17 positions. That was a couple months lost getting it through kind of internal bureaucracy. Maybe sometimes I need to jump on this table here and shout that we need help. But at this point, there is nothing more important to the county than our COVID response. So more support from our board, our CEO's office, our other departments, and all getting together and saying, we all have our individual departments and our day-to-day jobs, but the COVID response is paramount to the county.
And I would, understanding what you're saying, I think we need a response, a hierarchy, and I believe we need a response team that helps organize and a flow chart of authority that just gets things done according to what's needed. They've got experience, they've got manpower when needed to enhance the implementation of all the plans as they come through, as they trickle, and as they modify and modulate. So I would ask that that if the board agrees that I think we're more than one of us has asked now and mentioned that we set up this structure. And maybe mobilize some of these assets, utilize them locally, and they've got experience in this department. So between the sheriff and the fire department, let's see if we can put together that structure and just again accentuate what's needed in a timely manner, especially from mobilizing and the assets that they have to organize and do exactly that. I do have some questions, and I know we've got from the CAO's office, Mr. Palin, you've got a request to speak, and I have some questions as well.
Sure. Thank you, Mr. Chair. So listening to all of your comments, and I'll play the new person, new guy at the county card. It's been confusing for me even to kind of understand what's going on given the diffused responsibility of all the different departments that you see here. So that's why Mr. Diedrich mentioned that we had a meeting this morning. I convened a meeting to get everyone in the same room to hear the same thing, to talk about all of the issues that are going on and to come to common consensus and to formulate common action. Because I think it's our office's philosophy is that, and your board sets the priorities for all the staff, is that this pandemic is the county's #1 priority. I don't see how any other topic or issue could be as important as getting us to herd immunity and getting us to that we can reopen businesses and get people back to work and get the schools back open. I mean, that's others may disagree with me, but I just see that as our primary responsibility. So the question is, how do we go about marshaling all those resources to be able to do that? As Dr. Park said, there are things that Mr. Diedrich said, the supply of vaccination is out of our control, right? I mean, we've talked a lot about that. What is in our control is to stand up that infrastructure to be ready when that vaccine comes. We have to be ready to deliver it. And I think we're really getting there. As Mr. Diedrich mentioned, I think we are getting on the cusp of being able to deliver several thousand doses a day, which is right where we need to be. So I hear the board with that those structure issues and who's in charge and that point person or point people or point team to be able to make decisions, hear the issues, hear the common issues, and talk about them and decide on them. Agree 100% with that. That was actually part of my kind of thought process in getting all those people and things together. I think the messaging is going to be absolutely critical. We need to have, looking as we were sitting here, I was clicking through all the different places on the county's website where we have COVID information. You click on the banner on the front, and it goes to the OES site. Then Public Health has its own COVID information. Dan Birch's shop has its own COVID information. We need to get that pertinent vaccination information right on the front page, and within 1 or 2 clicks, have what the public needs to know. Have that those numbers that Mr. Wynn was talking about how many vaccine doses do we have, how many have we administered, how far along are we towards completing a certain tier. Again, sensitive to that. We're going to make mistakes. The environment with the state in particular changes literally every other day, it seems like. All those things, I think the public has to be patient along with us as we muddle our way through along with every other jurisdiction in the state and frankly in the country. So again, I hear all your issues and concerns. The county administrator's office is here to support as best we can and to marshal whatever resources as best we can to tackle the issues head on.
Thank you, Mr. Powell. And we want to come together here. If we're missing levels of communication, if the responsibility as chairman is to be present at meetings and give a press release and share information, or to just stand there behind you guys and nod because we're getting this information out to the public, whatever it takes. All the supervisors have brought up that people are missing the information. If we can accentuate, as Vice Chair Wynn pointed out, seems to be more bountiful information in adjacent counties. We know that we've seen news reports about what they're doing in Sacramento or they're doing in Stanislaus. Our phones and emails start blowing up because it's not happening here. And this is not by anybody's fault. This is just the environment that we have and what we're inheriting by what the state's allowing and the administrative process that's going to take and the limited supply. So I have a couple questions to go through and then maybe get some answers. Did you have something, Mr. Diedrich?
No, I just, not to say woe is me. I mean, we're at the height of the pandemic. We have a lot of turnover. I think most of our public IT is in quarantine. I mean, there's no wins for me. So.
Understood. And this is a task for everyone, but I firmly believe that we are well suited to address it. And we just want to bring in the reinforcements and the support that you all may need. So, how many people, when we're looking at phases, phase 1A, so we've gone through phase 1A, Dr. Park, that's correct? And those that chose not to participate, those numbers are released and they can be applicable. Those doses can go to phase 1B. And then my question to that would be, how many people have we identified? How many doses do we need for 1B? And there's maybe a percentage of 40%, 70% of buy-in, those wanting the vaccination, but what's those numbers before we can open up to other sectors?
So we are finishing up 1A. What we've completed is inviting everyone in 1A to get a vaccine. And there are 36,000 healthcare workers. So we believe we've done our best to reach all of them. Some of them are still perhaps waiting on their appointments to get their vaccine at one of the vaccination sites that we've offered. I don't know how many, and that's what we need to look into. But yes, technically speaking, we have offered to all in 1A.
What's the buy-in on that? I'm sorry to interrupt real quick, but what's the buy-in? If we have 36,000 people in Sector 1A, how many people have gotten the vaccination, and what was the percentage of interest?
Right, so I would say the buy-in's been somewhere around 40%.
Okay.
And it just depends on the sector and what type of person you're talking about.
Sure.
Now, the state did say that there were 2.4 million healthcare workers in the entire state for 1A, and then they told us that we had 36,000 healthcare workers in 1A. For 1B, they're saying that there's 8 million or more people in 1B as a state, but they have not given us numbers on how many we have in 1B. We've tried to do some digging on our own. According to Chuck Davis from Bayesian, we have 115,000 people, 65 years and up in the county. My EPIs have that at 96,000. So a little bit of a difference there. If you were to do a 75 and up, it's right around 40,000 people who are 75 and up in our county. According to Chuck, 40. According to my EPIs, 39,000. So those numbers match up. Law enforcement, we believe we have upwards of 10,000 people in law enforcement that we yet need to vaccinate. In our K through 12, the Office of Ed has been gathering numbers. They've been gracious enough to gather numbers from our private and charter schools as well, and they believe they're going to need 20,000. And according to our ag, we have 10,000 farm workers. So 10,000 farm, 20,000 teachers, 10,000 law enforcement, 100,000 people 65 and up, and as I said, I'm receiving 3,000 vaccines this week. So that's the numbers as we have it. That doesn't include childcare, which we were really working hard with the teachers and the childcare before all of a sudden we had to pivot with the 65 and up with the announcement. We were more prepared to move forward with them, with those groups. But we believe we have as many as 800 to 1,000 childcare providers. And as far as education goes, we're told that it doesn't stop at TK through 12. Education includes our institutes of higher learning, so our colleges and universities is not included in that 20,000 number. I don't know how many we have of those, but those are the numbers that I have.
So pause for a moment. You're talking about students getting vaccination?
No, we're talking about the teachers.
All teachers. So we are not, that was a question that came my way, we are not asking students or adolescents to get the vaccination.
No, it's not their turn, and the vaccine hasn't been studied in kids less than 16 anyways. So we're talking about teachers, but that includes the principal secretary, the janitor, the cafeteria. We're talking about entire schools need to be vaccinated.
Okay, great.
All included.
Thank you. A lot of numbers. What have we requested? Do we have any mechanism of requesting anything, or is this just an allocation based on state and bureaucracy?
We can request what they offer, and we've never turned down an offer. So they offered us 1,950 Pfizer and 1,000 Moderna. And we said, yes, we'll take it, which is the 2,950 that we're receiving. I did hear from my staff that we just got another offer for 2,400 more Moderna this week, but it might be that lot number that cannot be used. So it might not be usable. We don't know what we're getting, and the state doesn't know what we're getting. When we open the box, we'll know what we get. So that's what we're getting, and we can only request, it's called a request, but you're not able to request your actual wish. You can only request the number that the state's offering. And the state offers based on how many people they see in your tiers.
Well, that was my next question. Is based on the very high numbers in San Joaquin County, are we getting more or less than other counties? And the reason why I ask is I heard it was advertised on TV, right or wrong, that there was 100,000 doses in Stanislaus being distributed at some point in the last, now this week or whatever it was. It was reported in the news. I'm not saying it was accurate, but it was reported. I saw the report live, and then my phone started ringing and people from here were going to Stanislaus over the weekend to get the shots. So
I doubt very much that they've received 100,000 total when we've only received 34,000 total. So I can see everybody else's numbers. They're getting a little bit more than 3,000. We're getting a little bit less than 3,000 this week. So it's not very different.
Okay.
Sacramento's getting 975, not even 1,000. And so they're up in arms because they're being asked to manage Cal Expo. And with a trickle of vaccine, it's really an unrealistic ask. So this is what Mr. Diedrich has been saying, is that, yes, it appears we have a lot of vaccine, but we're ramping up tremendously. We were prepared to do some sectors And we can get through the vaccine quickly as we ramp up, but now, as we pivot to the 65 and older, it's obviously not enough for all of these sectors, given the numbers that I just shared with you.
And the numbers you're speaking are only the ones that transit public health department. There's also a federal partnership with the pharmacy, CVS, and Walgreens going to the skilled nursing facilities in our county. We have data about that. That doesn't transit our department, but we know what skilled nursing facilities they've gone with the first and second and third wave of those doses. And then in addition to that, there's also what's termed multi-county entities. And these are healthcare delivery systems that also have an insurance product. So in our county, Kaiser and Sutter, they get direct distributions as well. That was primarily for them in that initial wave to vaccinate their own healthcare providers. But that is also now they're getting doses, and the 65-year-olds that are in their insurance product might be called into those multi-county entities. I did have a conversation with Betty Wilson yesterday morning about, she asked me what guidance I could give her to have her members advocate at the state level. I want to make sure that the state, because of the perception that these multi-county entities are moving the vaccine quicker, do not allocate more to those multi-county entities and short local health jurisdictions, because we are on the cusp. We have the capability now to vaccinate all the doses they're going to give us.
Understood. I think one of the takeaways today then is if we can increase and change and add some of, as Vice Chair pointed out, some more information to the public. So the question then would be to you is, how can we communicate? Do we have an agreement? Can we get some information to the Stockton Record that they'll do something on Monday, Wednesdays, or Fridays to get some information out to the public? Do we have to hold press conferences, press releases? What do we need to do to get more information out to the public that need to know that, yeah, we got 2,000 vaccines coming in, not 20,000, and there's a registration process. This is the mechanism of how to do it. How do we best communicate, as you've heard all of us really bringing this point to light?
I'd say the absence of the information, and indeed we need to communicate more. In that absence, people hear things and start to believe things and repeat things that aren't exactly true. So I think more press releases. I don't think we've actually had a press event where we physically took questions. Obviously, COVID has some complications there, but more timely communication, that's something that could be enduring on our website that is sent out as press releases, and hopefully the press picks that up.
And is there anything as far as the emergency broadcast system that we have at our disposal that can be done without it sounding alarms and being that dire emergency? But every week, every day, I get the COVID update on my phone. Alarms aren't going off; it just has information that I forgot if I signed up for it or if it's there's a mechanism that goes out to people. But maybe we can utilize some of this.
And Shelley Lima will be able to speak to that. I think you have to sign up for that, and it does push out information to you. And we did look at the emergency broadcast system earlier. I think we need more of an exigent issue. Maybe this could have been, at the height of the pandemic, go get tested. But I don't think there's anything right now that would allow us to pull that trigger.
Good. All right. So then, as we've talked about, and any other supervisors have questions, but we've talked about an hierarchy. What's our next step forward? Would you like us to form a committee, an ad hoc committee, to help establish that structure?
I'd be in favor of that, and working through Matt Palin and the CEO's office to get that, as well as our OES partners. I think we have a lot of good partnerships, but it is a federation. Absolutely correct. And let's utilize these assets that we have at our disposal. I appreciate that. So, Mr. Palin and County Council, I'd ask, if we're going to do an ad hoc committee, how many board members could be a part of it? Two? Okay, thank you. Do we have to decide right now?
No, you can bring it back at the next meeting. There'll be a COVID discussion on for the next meeting, and so if you want if you need time to think about what the role of that ad hoc committee will be, that'll give you a week to think about that and perhaps have that more formulated.
We can't talk about it, though. I can't talk to different supervisors about it. That would be a Brown Act violation. So
that's
I
correct,
think
but each of the supervisors can think about it and get their thoughts together for the discussion next week.
Okay, well, let's do that then, since it's a short time till our next meeting. As chairman, I believe it would be my responsibility to be part of that and one of the voices for the county. It's a position and it's a responsibility, and I accept that. So then we can, other supervisors can discuss their interests in participating. Vice Chair Nguyen brought up a great point. They've got institutional knowledge between he and Supervisor Rickman. Any other supervisors have questions or comments or statements that they'd like to bring up? Yes, Supervisor Miller.
Thank you. Two things. First of all, I think the ad hoc committee idea is a good one. From my own standpoint, I would be very comfortable with both the chair and the vice chair serving on it. Vice chair has some experience, having been the last supervisor to actually serve in that capacity. I think that experience would be valuable, and I think as the chair, certainly you should be part of that. So from my standpoint, I would be very comfortable with the two of you helping to work on coordination. And secondly, we've heard over and over about how there's perhaps the need for additional resources. These are essentially one-time resources that are needed for a very extraordinary time. We do have the additional funds from the CARES Act dollars that are in reserve in our general fund. The board has on several occasions made the statement that we are very supportive of utilizing those funds for this effort. So I would just like to say it again to encourage this group, and Mr. Paul, and you're helping to coordinate with this. If we need these resources, I don't think we should be saying we don't have the ability to do it. I agree with you. There is no effort more important than getting our residents vaccinated as quickly as possible and moving our county back toward recovery as soon as possible. So from my standpoint, I'm just saying it again. The board we've said it at numerous board meetings. Those dollars no longer have the original strings attached to them. However, they were intended to help us as a local government meet this crisis. And so I am completely in support, and I would like to see, as the ad hoc committee meets with you, I would like to make sure that we provide the resources for all hands to truly be on deck for this effort.
Thank you, Supervisor. We are returning next Tuesday with an ask of $5+ million, as discussed at the oral report. I am very pleased in this county. I can have allocated part-time positions without coming to the board. So we've already moved forward with the vaccination team, and I know Ziana's here, but we probably have outstanding recruitments for 50+ individuals in public health. But it is a process.
Right. Thank you.
Yep, thank you. And quick follow-up on something before I forget, and I'll turn over to any other supervisors with questions. One of my notes is I've gotten some requests from people that are without the technology. They've communicated, contacted the office, but they may not have a smartphone to do an app. 87-year-old gentleman that's not able to be easily mobilized and brought somewhere. Could we have a strike team that could go to some of the individuals that it's not a big strike team, but just a small group or one or two people that could go give a vaccination as needed for some of the elderly and most at risk?
I do believe it's a potential, and as Dr. Park mentioned, the long-term care facilities, not so much the skilled nursing facilities, they are not part of the federal pharmacy partnership, and those people are aged and more vulnerable, so we will be taking strike teams to those facilities. Can I get to every single address in the county? Some challenges there, but as we identify the most vulnerable, we're going to do as much outreach as possible.
Okay, thank you. Appreciate that. And Supervisor Rickman, did you have another follow-up?
Yeah, just real quick. Thank you, Chair. I was just looking at some paperwork here I have, and I got some information from the California State Association of Counties, and this was from Federal Guidance on COVID Relief System Program. State issues immediate hospital capacity orders, and counties may apply to allow EMS personnel to administer a vaccine. And it says in here, counties seeking to increase the number of personnel who can administer the COVID-19 vaccines may allow paramedics and emergency medical technicians to do so after receiving approval from the State Emergency Medical Service Authority. And when can we get that done? Have we done that? Is it something we can do?
I believe paramedics and EMTs with that expanded skill scope have, some have undergone the mandatory training and some are authorized. Dan Bertram Mohawk could probably speak more specifically to what paramedics that are approved in our county have that expanded scope under Dr. Schaefer, the EMS medical director.
Well, looking at some of the information here, is it 28 LIMSAs have received approval for public vaccination by paramedics, including, and there's a bunch of counties, we're not in here. 27 LIMSAs have received approval for EMS personnel vaccination by paramedics, and from EMTs, there are 3 counties. So
Supervisor Wickham, if you're looking at a CSAC communication that came out about 2 weeks ago, San Joaquin County was not listed in that, but indeed locally we had approved paramedics, but unfortunately that information did not flow from San Joaquin County EMS to the EMS authority, but we definitely do have paramedics that have been approved to be vaccinators of the COVID-19 vaccine.
So we were in that.
If we had gotten our ducks in a row and informed the state, we would have been included in that communication.
Okay. Would you know for sure? Well, we're having this again next Tuesday, so during the COVID-19.
If I could invite Dan Birch down, I think he's a lot more in tune with who has been approved and what they've done so far.
That's fine. I just wanted a yes or no.
That's a yes.
Okay. All right. Thank you. Okay, thank you. And lastly, for me, what do I tell my constituents? After this meeting, I ask, and we're all going to get the same question: is when can 65 years and older population get vaccinated? How long?
Well, and you know, I had this discussion with our staff this morning, and I did show them the graphic that Stanislaus has, where the color goes into the 65-year-olds and up, and that's basically what we're doing. We are doing phase 1A and drawing in the 65-year-olds out of phase 1B because we've been told to initiate them and prioritize them before the others in phase 1B. So that's what we've been telling folks. As we finish phase 1A, we have started on our 65-year-olds and up with an eye to hopefully starting in on 1B in early February.
In early February. So more information will be coming out through the locations and where they can get administered. So if somebody asks me, which they're going to ask me right when I get out of this meeting, so the answer is February. So we can't, so we have 2 weeks for not vaccinating.
Well, we've started already, but I think it really boils down to the math. If there's 90,000 in our county, and there's probably going to be a much higher take rate than our healthcare. So let's say 50,000 people want it. I'm getting 3,000 doses this week. But if I'm only getting 3,000 doses each week, that's also going to be second doses. So I can vaccinate all the doses I have. But if I have 2,500 doses a week, it's going to take me 20 weeks to go through that. So I just want to have the realistic expectation that just because you're over 65, I can't do you tomorrow. And that's just a hard reality. Getting more vaccine is going to solve a lot of our problems.
And lastly, Chair, and so looking under, there's been a lot of talk about the Standardized Emergency Management System, or SIMS. So the structure of it, the command structure, the sections and branches and so on, division groups, how it's set up to a flow chart, you wouldn't be able to fill that out now, right? So that's what that subcommittee is going to do?
I believe OES has NIM SIMS. I believe Public Health has NIM SIMS. Those structures, they exist in OES, EMS, Public Health. Is there an overarching county level one?
What I'm asking for is, who's our command staff? The incident commander, their staff, and then on who's in charge of the operations section, who's that, planning section, logistics, finance, and so we have specific people in those categories. So we know exactly who's plugged in there. So if there's a question, we can go to those individuals and the command staff, who's, the top person and who's underneath that command staff. So what I'm saying, do we have that yet, or is that what for the subcommittee is going to be plugging in? we have that. If you have that, can you give that information to all the board members? And Chair, also, I know you said you wanted to be on this. I'm fine to bow out of it. I don't have a problem with that. I know Supervisor Nguyen and I have, know the same kind of information. So, I'm fine with him, you two being in that subcommittee.
Thank you, Supervisor Rickman. To that point, just so that we show the public that we're not waiting for the next meeting and have another meeting and keep talking about it, for an ad hoc committee to be appointed, County Council, can I just declare what I would like it to be, or do we bring it to the board for a vote and approval?
Takes a motion, a second, and a vote.
Okay, well then, Supervisor Rickman or anybody else, if you'd like to make a motion, a nomination, and someone can second it, we can see if we can get this done so that by next meeting, we have a report already.
No, and I think that's prime, and we need to get this on as soon as possible. So I'll make the motion or nominate our chair, Patty, and Supervisor Nguyen to the subcommittee for the SIMS.
I'll second that.
All right, we have a motion and a second. Please vote, and I believe the computer system should work. Yes. All right, that motion carries, and it's adopted 5-0. And I appreciate Vice Chair Nguyen actually suggested we move this forward so that next week we come back with some information that we can share as a board. So thank you all and appreciate this. I know that we have some, I'm sorry, before we move on.
Thank you, Chair Petty.
I have
a quick question regarding the seniors and 65 and older. If you're a veteran, do you recommend they go to the Veterans Hospital, or do you recommend, if they're older, like 75, 85, is there a health risk in taking this shot? Or, I mean, do you guys, if an 85-year-old walks up, is there any, are you worried about any complications? Or?
We don't worry for any of the approved ages as far as the safety and efficacy of the vaccine. We're trying to promote the safety and efficacy, and it's 16 and over for Pfizer, 18 and over for Moderna, and as long as you're in any of those age categories, yes, anybody should be seeking that.
So if you're a veteran, should you go to the VA hospital you recommend, or
if that is your primary care provider, that is the recommendation, is that you seek it out with your primary care provider first. Ask them when they're going to have it, or if they have it. As we've said before, Sutter and Kaiser, some other entities might already be offering it. So we would prefer that you seek it out with your provider first. So yes.
Great. Thank you, Doctor.
All right, thank you. And I'm going to ask then that we have public comment and it be shared from Madam Clerk.
Thank you, Chairman Patty. We do have several public comments that I'll read now. The first is from Cassandra Burdick, who writes, I'm a concerned citizen and a county employee. I'm very disappointed in the county's response to the vaccination protocol, specifically vaccinating groups of people that do not fall into the first three categories in Phase 1A. I'm not saying that I'm mad that others are getting vaccinated, but with the limited amount of vaccines, I'm very concerned that the second largest building of employees under the county umbrella hasn't even been given the opportunity to be vaccinated before community agencies, non-healthcare, that have been closed to the public since this pandemic started. We have employees who cannot work at home even one day a week. CPS social workers are required to enter people's homes, whether they was COVID or not. CPS social workers are being required to enter several homes during a day and then come back to the office, possibly spreading the virus. CPS social workers and supervisors being forced to go to court several days a week, packed into a courtroom with people who are known to not follow protocol. Yet because our employer has not hounded Dr. Park, we are not being considered. I know for a fact that an agency that provides services to people with developmental disabilities has been given the approval for vaccinations. You need to know that this specific agency has been closed to the public since March, and DDS has ordered that they do not visit consumers until June. Other counties have vaccinated their CPS social workers, knowing that they are serving at-risk communities. Why are we not being given the same consideration? The next comment is by Alex Alaferis of Lodi, California, who writes, our society forgot to question policies and events. Our society forgot critical thinking. Why are you promoting deadly COVID-1984 vaccine when there are low-cost therapeutics like anti-malaria drug? Did you know that high dose of vitamin D, vitamin C, and zinc will prevent this flu called COVID-1984? Why is the default solution the vaccine? Did you know that nations in Africa reject any Bill Gates-funded vaccines? Did you know that the COVID-19 vaccine killed 29 seniors in Norway? That Norwegian doctors issued a warning not to give it to seniors? In New Jersey, seniors who took vaccine died. Why are you promoting it to our seniors? Nurses, doctors who took this vaccine have deadly side effects. Some died. Why is this info not being reported? Question, research, any government worker, nurse, doctor, law enforcement officer, etc., please question and do not take this deadly vaccine when you take vitamin D, C, zinc, etc. Don't be fooled. Your body, your choice, freedom of choice. The next comment is submitted by Cindy Green, who writes, this past weekend, January 16th through the 17th, there apparently was a COVID vaccination clinic meant for healthcare workers. The first I knew about it from friends on social media, and by then the crowds were lined up for miles from the Ag Center where the event was occurring. The focus shifted to include people over the age of 65 being vaccinated in addition to the original focus group. I have no issue with the people included in the target group vaccinated or even including over 65s. My primary concern is the total lack of transparency by my county government in keeping us informed. I'm sure had there been information about this event and who it was aimed at, you might well not have seen the backup and people just turning up hoping to get a vaccine shot. But keeping this information from the public resulted in suspicious that either the public is not to be trusted with this information or the government knows best. Both of these are insulting. The people making these decisions are public servants. They serve us. We are not children to be coddled or looked down on. We are adults able to take information and make our decisions. In the future, I sincerely hope that all decisions and events are done in public rather than behind closed doors. And Ms. Green goes on to ask a couple of questions following the presentation today regarding the daily updates to outreach and recruitment. She asks how the public can access these updates. And then in response to Dr. Park's comment about not making the flyer public due to concerns it would inundate their clinic, Ms. Green writes, that is exactly what occurred when word got out on social media. By making it public, one would hope people would have enough sense to let those invited go and wait their turn. What I was seeing on social media is that the lines were miles long. The next comment was submitted by Nancy Sotoyama, who writes, thank you for having the event, but it would have been helpful to have some notification. We only heard about it from our neighbors. Also for the next one, please have more porta potties spaced throughout the line. We had to wait 5 hours, and that is way too long for seniors to wait without a bathroom. The next comment is anonymous, and they write, does the county have the authority to release all doses of vaccine in our inventory to maximize first doses? Understanding the state wants us to hold in reserve, would you consider getting what we have out there since there is no maximum time to successfully administer the second dose? And lastly, this last comment is anonymous, and they write, it is the intent, if the intent to distribute the vaccine in a targeted manner according to geographical hot zones, is it not possible to utilize the same system that polling centers utilize to target and direct voters to specific polling stations? Also, an alternative way of verifying residents in a hot zone might be requesting that those responding to the invitation to vaccinate from a certain area bring a proof of residence as simply as a utility bill or other piece of mail. This could be offered as an alternative to bringing a photo ID, which often do not display a current address. The system is already utilized in many state and federal registries to verify residents in a particular area. Namely, this system is already used to purchase a firearm. If it is a good enough system for the Department of Justice, I don't see why it could not be utilized there. No personal info would be collected, only used for verification, then retained by the individual. This may prevent any particular vaccination facility from being overrun by people from outside the targeted vaccination hot zone. And Chair Patty, that concludes our comments.
Thank you, Madam Clerk. I believe we're done for today. I just want to let you know that we appreciate everybody's efforts. We are collectively, working together, and you've heard things that we've shared from our constituents. You've heard some public comments, and I know that we'll address them, and we'll continue to evolve this process and levels of service that we can enhance. This meeting is adjourned until Tuesday.
Chair Patty, I apologize. We have a comment from our Veterans Officer, Virginia Wimmer.
Please.
I would just like to read real quickly. She writes, the Department of VA is not offering the vaccine to the patients just yet. The Federal Department of VA is focusing on VA healthcare workers and veterans living in VA long-term care facilities only. Palo Alto healthcare system is following federal guidelines as directed. There's no plan to vaccinate the general population of veterans until these two groups have been served first. Our county veterans will have to go through county or state entities if they meet the minimum eligibility as outlined by Dr. Park and Mr. Diedrich.
Okay, and we are reaching out to our veterans as needed as well, correct?
Correct.
Plan?
Yeah, their part, I'll work more specifically with Virginia Wimmer, but basically if they fell into those primary tiers, the veteran status by itself was not a factor, but if they're over 65 or an essential worker.
Understood, but just finding through their mechanism of communication, since a lot of this is being done by invitation, so this, sounds like you are, so yes. Thank you, I appreciate that. So as I was saying, we are adjourned until Tuesday, January 26th of 2020 at 9 a.m. Thank you, everybody.